All right, so just like America leads us in almost everything we do, and it's fine because they are a country that they are good and they are actually advancing in everything. So for radiology too, there's kind of like an association that oversees the activities in a radiology lab, and that's what is usually known as what the ARRT, fully known as the American Registry of Radiologic Technologists. Okay, so they put out some one or two rules that help in the different coordination of activities in the lab and the rest of it. So this is what is known as a Code of Conduct of American Registry of Radiologic Technologists. Okay, so this is the this thing. What do they call it? The symbol. You can see the O here. You can see the 2 pi. Okay, and you can see the imaging modality here. Just spice it up, and this lightning here actually shows what the radiation energies that we always deal with in radiology. So what is our code of conduct? Their code of conduct is just some set of guidelines that actually what sets the profession standard for anybody that wants to say, okay, yeah, I'm actually a radiologic technologist. Okay, so the code of conduct is ensuring that the patient is safe. Of course, without the patient, you won't have a job. Is ensuring that the profession doesn't lose its how will I say quality. Yeah, you could just put it in your own way, and high quality care. Okay, so in emphasizing on integrity, respect, responsibility, a lot of things. So overview of the code of conduct of this American Registry of Radiologic Technologies include we have the code of conduct, which is aspirational guidelines for the professional conduct. We have the rules of ethics, which is we have code of ethics, we have rules of ethics. So those ones, the rules of ethics are the mandatory things and standard of the behavior that is expected from you, and nothing less than this is always expected. Okay, so this actually serves as a moral compass for all those radiographers, help them to evaluate a lot of things and help them to be able to relate to patients and also their colleagues and also people that employ them and the rest of it. So the key principles here is first we have professionalism. So you always act in a professional manner, the way you talk to people, attend to your patient need. If your colleagues is calling you for there, you always, you can't disgrace your colleague in front of a patient and all of that. You have to respect people. Then we also have service for humanity, where human life comes first. Okay, for everything you are doing, for every service you are rendering, you always know that human life comes first. So always place the patient welfare above your personal gains. Then quality patient care is you have to deliver safe, effective, and compassionate care. Always strive for excellence too. Okay, so that's it. So integrity and honesty, you have to always be honest. You build very good relationship with people, so that if you attend to somebody in the hospital, even when you guys meet outside, the person still respects you. Avoid fraud, avoid deceiving people, avoid misrepresentation. Okay, so confidentiality, you have to protect the patient's information, you have to respect their privacy. You have to share patient data only with people that are authorized to access it. The continuous learning, you have to always learn the new trends. Okay, stay updated on every other thing that is coming up. Then ethical collaboration, you have to work respectfully with other hospital workers that will always maybe bring jobs to you and the rest of it. Okay, so this is the code of conduct that we always say the American Registry of Radiologic Technologies. This is the code of conduct that they actually operate upon.